This is one from our last cases. The patient is a young male, 45 years old. This is venography of the right internal jugular vein. In this case, you can see here a very sharp margin of the valve. This flap is fixed, there is no movement, and in fact, despite of large silhouette of the vein, in fact the true flow is only in very small area here on the middle part of the vein. And this is one another case with true stenosis into the J1 junction. We perform liberation of the valve with two balloons 12 and 14 millimeters, and this is the image obtained at the end of procedure of liberation on the right side with bigger balloon. This picture can be compared with the other one, you know, the previous image with very severe stenosis at J1 junction. In this case, we used two balloons to obtain enough dilatation of the lumen. And this is the final result. You can see very fast flow after liberation at J1 level without any defect into the lumen of the vein. And also this case also you can compare it with this one, where we perform liberation with two balloons. Also there is very good and fast flow without any residual stenosis at that site. Patient on the left side we found good J1 level without any stenosis, and very slight stenosis in the middle part of internal jugular vein. You can see compression on the middle wall from the carotid bulb, but the flow is very fast. This is the left side. In spite of some stenosis at J1 level, we decided to move down one balloon with a diameter 14 millimeters, and to try to apply pressure on the flaps on the valve and to put them in correct position. During this maneuver, the patient didn't feel any pain or some kind of discomfort. And this is final angiogram. The flow is very fast, without any stenosis here and without any interluminal defect at the side of the valves. This patient had excellent flow into the azygous vein. There was no sites of stenosis, there was no interluminal defects and malformed valves. You can see the very good flow into the azygous system. And when we performed contrast venography of the ascending lumbar veins, we saw excellent flow into the veins without any reflux to the pelvic veins, which means that in fact in that patient there was no disorders into the flow of the azygous system.